Good evening, everyone, and welcome to 2021 for us. My name is Rudy Page. Welcome to Overcoming Unseen Barriers with one of my great colleagues, Beresford Dawkins. Dawkins, as in Beresford. How are you doing?
I'm very well, thanks, Rudy.
Excellent.
Very glad to be with you, and Happy New Year to you.
And Happy New Year, Happy New Year. So we will actually be rebroadcasting this show on Fresh FM Radio London next week. So Beresford, the title for today is Mental Health and Spiritual Wellbeing.
Yeah.
And of course, we are now in what we call the COVID post-pandemic era. And it's one of the most, it is the biggest health challenge of our generation, in fact. And the link with our previous programs around battlefield of the mind is really apt in this day and age when it comes to mental health and the spiritual well-being of individuals, communities, families, and society as a whole. And we, of course, being from the African Caribbean population group, particularly now that the health system talks about population health, is that, so how are we going to contend with, the structures, the systems, the representation, the involvement, and what are our plans for taking care of ourselves and actually keeping ourselves out of the care system in terms of the NHS, the health system, if we can. Then having said that, what do we do about those who are in the system? What is our role? What is our responsibility? Their friends, families, people we know. So we've got quite a lot to contend with. So So we're really setting the scene now for the next 12 months. So I'm glad it's on your shoulders, to help.
No pressure then, really. Huh?
No pressure. And, and what I require from you is the clarity and definition.
Okay.
Which, of course, people like myself, that's what we work with in order to implement, or order for the implementation process.
You implementation people there.
Exactly, but we want clarity and definition.
Sure.
And the evidence, the evidence base, so we can look at the recommendations that you make and then translate them into programs that can be, workable plans and make a difference on people's lives. And where necessary, create new structures, new pathways to reduce the inequalities. Tall order, but
it is. And I think you're right, Rudy, that we are facing one of the biggest health challenges of our generation. I think that is true to say. And that actually means that we've probably never been here before in that way. And for me, though, I think COVID-19, as it's described, has really put the microscope on some of the historical, systemic, institutional health inequalities. So yes, we are facing the biggest crisis of our generation. But I think all COVID has done, certainly for me, as you know, I work in the health service, mental health specific, and we look after 60,000 patients a year. And that's increasing on a yearly basis. So yes, we are facing one of the biggest challenges that we've ever faced. However, I think there are some historical systemic issues that we are still grappling with and still wrestling with. And what I want to do is kind of like talk about those health inequalities, if I may.
Yeah.
And if you think about some of the policies that you referred to and some of the clarity that we need to deliver on this agenda. I have to tell you, we can go back as far as Stephen Lawrence
Yeah.
when we think about some of those systemic issues. We can go back as far as, and that was in 1999, by the way.
Yeah.
And if we go into Rocky Bennett, he was one of the black men that was killed, sadly, within a mental health institution, and that recommendations and policies came out there, 2003, 2004. And more recently, we had David Lammy report around the Windrush issues, and that was 2014. And then we had, we now have a plethora of reports from Public Health England, and also the Health Service and Health Watch around the health inequalities for BME groups. And then more recently, we've had Baroness Doreen Lawrence, what a champion for health inequalities within our country. And her report is called The Watershed Moment. So, you know, when we think about all of those things, and at the moment, all we're saying is all we can do in terms of a response to that is hands, face, and space. Yeah, and whilst I am not playing down the pandemic situation, and we now know that there is a vaccine available to us, and that's a contentious problem all by itself. But, you know, when you think that we have a global pandemic and our response is, or the most consistent response is, whether we like it or not, is hands, face, and space. I think that's a tragic situation for us to be in. For some of us from our communities, one of the first principles of cleanliness is next to godliness. We're washing our hands. We've been washing our hands for years. We know how to keep ourselves clean and tidy. And one of the core things at the heart of the response to this pandemic is hands, face, and space. So the truth is, the world is changing, and like I said, it's one of the biggest health challenges of a generation, and we're evolving. You know, we're developing and we're growing. So the question is, how are we going to equip ourselves? How are we preparing ourselves for these changes? How are we going to navigate? You know, how are we mapping out our direction? Like I said, this is a historical problem. You know, I have to say, for me, and I'm sure it's the same for you, there are certain things around the health inequalities that are not new to us. But the question is, how are we mapping our direction of travel? How are we going to prove to be resilient? You know, what is our durability? And I think as a community and as a community, historically, we know that we can bounce back. We know that we can be resilient. But the truth is, how are we going to put things in place to support those when we look at the inequalities that we're talking about, and when we look at the disproportionality and the overrepresentation, particularly mental health services, how are we going to actively support those individuals? And not only that, so with all the trauma that we've experienced and all the inequalities that we've experienced, what is going to be our levels of self-control, devotion, and conviction to actually deliver this service? Because we know, and I'm sure you have a view on this, Rudy, at times we can be our own worst enemy. Some of us are strategically placed within the NHS, and my point is that it's time for us to collectively start having discussions where we can start to share and co-design, co-deliver best practices across the country, if not across the globe. And it's really good to see Dean, who I know joins us on a regular basis. And I'm sure that globally, some of these health inequalities are similar across the globe. It's time that we started to bring our whole self to the workplace. And I think certainly for our trust, we are constantly thinking about how do we self-actualize? How do we bring what we bring naturally into the workspace so that we can start to implement change? For far too long, our identity and our nature and our methods of delivery have not been recognized by institutions. Bob Marley says it like this: it's time for us to emancipate ourselves from mental slavery.
Yeah.
And music and arts, as you know, is a big part of how we have, over the years, have responded to many things. So it's time to, you know, the war that is going on in our minds, it's time we start to look at that more closely. If we go to the Holy Scriptures, Romans 12:2 tells us, do not conform any longer to the patterns of this world, but be transformed by the renewing of your mind. And again, we're looking at the mind and our mental health. So that's why it's important to understand what the scriptures have to say about it. And of course, the legend that is Bob Marley. So what are we going to do, Rudy? It's clear to me, it's time we start to collaborate. The terrain is difficult, it's going to be challenging, it's going to be risky, it's going to be dangerous, it's going to be the fear that we have in some of these new areas is going to be difficult. However, it requires leadership and it requires strong leadership. And again, I believe that if we were to pay attention even more so to some of these issues that I've raised, I know that the leadership sits within our community and there is no doubt that we can deliver this. It's clear that the NHS and mental health services are clearly saying, actually, we want to collaborate with you because we cannot do this on our own. And in fact, the government describes it as a 105 billion burden to society. Right? And that's in England alone, 105 billion in terms of the burden that mental health services alone becomes a burden for this country. So once again, we can see that, yes, and I do think actually it's the Cinderella service to health. But however, if you think of that 105 billion pounds, and where does that go? And I guarantee you that within some of our organizations, third sector and grassroots organization, I'm sure we could do a better job if we were to surround ourselves with some of that resource. So the collaboration is about removing some of that legislation that I've just described. It's about integrated care. And that integrated care is about sitting down with government, having the difficult conversations, and then be prepared to shape the design of the programs that we know we can deliver. And ultimately, it's about delivering better outcomes for patients and through those collaborative partnerships. As I've said, it's about breaking down the barriers. Let's face it, the terrain is hard to navigate. You know, it's not going to be an easy job. It's complex as it is now. Unless we get involved, we roll our sleeves up, and we, like I said, we know that the world is changing. People are living longer, so therefore that the underlying health issues are also affecting our people as well. So even though you're living longer, it means that also those underlying health conditions remain. And if we're not going to start talking about and creating spaces like this where we start to share, then we know we're going to have problems. So when I talk about underlying health issues, I'm referring to diabetes, prostate cancer, for example, high blood pressure, and so on. I think we should be also thinking about treating people closer to home. We hear constantly where, certainly in Birmingham, we have, again, several examples of where people are trying to care for their loved ones, but they're having to travel down south or even further up north because there are no bed spaces. So those challenges are real challenges, and these are things, again, that I think we should look at. moving along swiftly. So building the strong, effective care systems. And again, the systems are there. We know what some of those historical challenges are, but as I've pointed out in this slide, it's about greater collaboration, understanding the terrain that we try to get involved in, build those stronger links, and also start to think about how digital platforms such as this are a necessity in the last year, as challenging as the year has been. I know you yourself, Yuli, has used these digital platforms in a very unique and a very specific way. I think, again, with a lot more effort and us continuing to shine the light on the problem, digital platforms means that we can, again, collectively understand the problem, the complexity of the problem, and then design and deliver systems and processes that can respond to it. Spiritual, rethinking the spiritual care and emotional well-being. Now, I've talked about how we're going to align the systems and how it's important to have community partners and a lot more public involvement. And again, the government is literally, as part of their policy and as part of their mantra, they're saying collaborative partnerships and more public involvement is the way forward. And we've got to hear that. And again, so I go back to the question to our audience and to our services. We are evolving. It's time for us to start developing and growing together, equipping ourselves, preparing ourselves. We are the most research community that I know. And again, I could go back and when you talk about research and data, the government has more data and more research on our communities. The only people that are not aware of the data in the way that we should be aware, I would argue it's us. Yes, there are pockets of really good examples of that, don't get me wrong, but I think generally in terms of the wider region, we need to start sharing that data so that more people can involve. Our churches and our places of worship, work like this should be, I believe, the bread and butter. It's again how we navigate. It's about our forbearance, and it's about how we devote ourselves to the task that is in hand and deliver better outcomes for patients. So ultimately, and finally, like I said, it's not going to be easy. It's a fight, it's a war. And like I've said, that war for me is going on in our minds more so than because it's about emancipating yourself from that mental slavery, becoming adaptable, rolling with the punches, trust your strengths. And again, there is no stronger community than us. History tells us that, but it's time to step up, become adaptable, see the positives, and don't let this crisis go to waste. It's a famous term used by Mr. Winston Churchill.
Yeah.
And I think now is the time for us to respond and be resilient in this process. And I'll pause there really, because I'm sure you will probably have a lot of questions.
Certainly, and I'm pleased and thank you for that, Beresford. And before we go into a more general discussion about that, I also wanted to add some of the work that I've been involved in most recently, NHS related, and this is across Southeast London. And what was being looked at here was preventing a mental ill health crisis. And out of the key sort of ambitions, priorities, these are the priorities that we've picked to work with, which do align with what you say. So, social isolation, loneliness, and community involvement, supporting communities and groups who experience disadvantage.
Yeah.
And finally, supporting families, children, and young people.
And let me just add to that as well, really, while we're just really clarifying the menu, if you like. We're seeing more and more people become homeless. And what is interesting about the homeless situation is all the underlying health issues that we mentioned also affect. So you've not only got the mental health issue, but you have a multi-layered complex problem. So there's homelessness. You would probably have someone with diabetes as well, high blood pressure, and again, probably you throw prostate cancer in there, for example. So there are some individuals that have that multi-complex.
And that would be any chronic condition.
Absolutely.
Think of that, any chronic condition, which there would be a lot of those. Thanks for that. Okay, so that I think what you've given us there is definitely food for thought, from which we have to begin to, from my perspective now, having heard that, is that one of the challenges that we have is to agree a consensus amongst ourselves, And you mentioned about the challenge that we have around collaboration. And so having been involved in so many Zoom meetings over the last few months, and just hosted but also attending them, what I felt was missing was that there weren't what I would say the strategic priorities. So there was a lot of noise on the Zooms and concerns. So what I did, I analysed the work that we had been doing across different sectors, actually, and which aligns with this particular piece of work, in that the first one being mental health and spiritual well-being as a strategic priority. And what we mean by that strategic now, what I'm talking about, it's the direction of travel, and it's a priority in terms of where we're heading. Within that, we'll work out what we're going to do. But the most important thing is to be very clear. Direction, mental health and well-being. And now for us, that doesn't matter what sector we're in. Because as you know, I work across sectors. So this is right across the board. And that thinking and the challenges around that can be applied to any aspect of our lives, because it's a holistic. And the importance that you made the point around the whole spiritual care, of course, and the emotional well-being. Then the other area is the second priority for us is digital innovation and services. Again, you've highlighted that the importance of digital care, and we know the kind of decisions that are now being made in terms of algorithms and the whole AI. And we really need to learn a lot more about that, as you said.
And also the impact that will also have on people's mental health, because if you're feeling that you're under surveillance, and you got to understand that as a community, we haven't been able to move without surveillance for years. And now there's an official policy in the shape of AI that they're thinking of introducing, and in fact, not thinking, they've introduced it already. So it means that all of a sudden, that big brother that is watching you is now a very real situation. So for some people, in terms of, and let's badge it under mental health and the paranoia, let's use that term, is going to become a very, very real reality for a lot of people in our community.
Okay. And then the third priority is succession planning and youth development.
Yeah.
Because COVID uncovered the fragmentation across many areas of our lives in terms of, again, institutions, systems, structures, you know, whether it would be politicians, business people, community leaders, faith leaders, all that was laid very bare in terms of our community and the challenges that we had in terms of being able to pivot quickly and to be able to support through mutual aid groups. So, so that succession planning is important, of course. And then, of course, youth development in itself. And maybe you could say a bit about youth mental health before we move on a bit further on that then.
Yeah, sure. And you're right about the youth development side. We know that the suicide rates, for example, are higher than ever. I think we're seeing the dark side of the web being engaged in a way that we knew was there, but I think the rapid speed of which young people are engaging with social media is really having a massive impact on their mental health. And I have to say this as well, I think people generally give young people a raw deal in terms of how they interact. And they are prepared to engage, but I think there needs to be what I call that intergenerational connectivity. Yeah. There isn't a space where I see elders, if you like, and adult young people sharing the same space and getting that guidance, that natural rites of passage kind of conversation, and calling on the energy of the youth, but the wisdom of the elders, if you like. And so there's that energy of the youth. You know, we saw it throughout, you know, the BLM stuff. Yeah. But that needs to be fed and given the experience from some of our elders. There needs to be a space where that is happening simultaneously and also complementary to some of the challenges that we're facing. I don't think there's enough of that. Yeah. I will give one example though of where stop and search, as we know, and police powers has been a significant challenge for young people across the country. And certainly in Birmingham, we've managed to have a conversation on digital platforms with West Midlands Police and young people. So the West Midlands Police job was to share their role as police to reinforce that legislation around stop and search. And then the young people were saying, actually, that you're right to do that because it's your right to do that, but this is the impact it's having on us. And the education and the knowledge that was shared between both parties has led to both the young people and the police now creating a space where they will deliver a program that not only enlightens the young people, but also enlightens the police about the impact of stop and search. So again, you know, there are some really good things happening, even in the nature of the pandemic.
Yeah, and that's really good because that brings to mind, for me, from an implementation perspective, is the community dialogues. And you mentioned earlier on about the co-design and the whole intergenerational relationships. Because as part of this work, just staying on about young people, we've adopted the approach of young people need somewhere to go, young people need something to do, young people need someone to show them how. And exactly as you said, it's finding the space where that relationship of trust and cooperation can be built, and young people being given the opportunity to lead with their ideas, you know, encouraged by their peers, and then of course being able to go to the elders who've been there before, seen it, and can give them the guidance. And so that's quite a lot of relationship building.
Yeah, absolutely.
But it can be done.
Yeah.
And I think we're now in an era where the children of the Windrush generation are now the elders. And it's whether you should really still call us children of the Windrush generation, but that's another discussion altogether, given that I tell you I'm a survivor child of the Windrush generation. And, and we won't talk about the mental health of the children of the Windrush generation, given what's happened over the last 3 or 4 years.
That's another program within itself.
That is absolutely a program itself. So going back to your point, we've got some serious challenges, but we can think them through. We can think them through, and it is about a mindset shift. And as you know, that if you can achieve the mindset shift, that can lead to behavior change. And I think what we're saying in terms of, again, identifying the priorities, that it's then being able to reach agreement about what the leadership and management actions should be. And we're now talking about well-being leadership now, and emotional leadership, and all that type of thinking. Collaborative leadership, which I think is important, which is going to be covered in more detail over some more programs. But I think what we're just setting today is the framework, really, for which we're going to put the building blocks on. Is what I like about this. So the importance of the conceptual framework is essential. And then what we then have to do, we have to translate these ideas into workable plans for implementation. And we touched on the community dialogues. But what I would like to go back to, though, and you touched on it earlier on, and it's something that we see in the community, we see in families, we see in communities, and we see in the workplace. And that's what we're calling at the moment still self-inflicted wounding. We used to say, safeguarding, but really it's self-inflicted wounding. And so I'd like you just to give a sense of that self-inflicted wounding in terms of, in your experience, the impact of it, but most importantly, why, and what people can do about it, because we know it's also to do with the environment. So we live in going back to your earlier point, in terms of our community, we've lived in a quite tough and brutal social order environment, inequalities. So that has led to what I have identified as the self-inflicted wounding. So even when you're trying to assist our community, whether it's out, regeneration projects, or whether it's in workforce, service delivery areas, local authority teams, the challenges around that are immense. And as yet, I'm not sure, and you could answer this, is there a body of work that's actually looked at that and start to think about that self-inflicted wounding without it being presented as something negative? That's and blaming the victim. So what we don't want to do is blame the victim for that environment which they found themselves in. And it can be quite, prejudiced, discriminatory. But at the end of the day, people have to earn a living. They've got families to take care of, and all those pressures.
Rudy, again, I think this is a program all by itself. And firstly, I want to say this. I think that this discussion around, as you describe it, self-inflicted wounded, I call it, bringing your whole self to work. And what does that mean? in terms of the pressures. I think there should be two conversations happening. I think there should be one behind closed doors.
Absolutely.
Because I think, I think that's right and proper to do. And then the public conversation needs to be steered really well. And I think you're the right person to steer that kind of conversation.
Mm.
And it's good that we can touch on it today, because I think several of us, especially our sisters, and I'm going to try and qualify what I mean by that, are strategically placed, right? And in senior positions. And let's use the NHS as a classic one.
Yeah.
We know that the NHS, our community has basically built the NHS. And again, and that's no coincidence that when we talk about Windrush generation in 1948, and the fact that, the NHS is also 70 years old.
Yeah.
I don't think that's any coincidence, because we came here, we started to build. The fact that the NHS is now 70 years old, that is no coincidence.
Yeah.
So in terms of building, shaping, owning the NHS, I think, there's something to discuss there in a real sense of the word. And with that comes a sense of responsibility and accountability and leadership. And where we know that we have strategic leaders in prominent positions with the NHS, we know that for various reasons, some are systemic, some are institutional, some, as you say, are self-inflicted. We haven't really grasped the nettle and been able to move some of those systemic challenges forward in the way that I believe that we can and should have done. And that discussion is the discussion that I feel needs to be had behind closed doors.
Yeah, definitely in terms of behind closed doors, because linked to that self-inflicted wounding is that where you might be going in to examine a particular area of concern in terms of relationships between individuals, you come across values, and we talk about values of respect are a common ground for all of us, regardless of our background and status. But that also means then that our community are also participating in that organizational culture that is not positive for their well-being and colleagues' well-being. So trying to then work out what to do about that can become a contentious issue. And I've always said, as it relates to, as you touched on, with the particularly the African Caribbean population group involvement in the NHS as working in the NHS, but in terms of receiving care and services in the NHS, that's been a great challenge. And of course, the COVID again uncovered that, where when we looked at the lack of representation from our community in those voices about the services, the quality of services, there was very few people to be seen or heard. So even if they were in the system, they were not heard for various reasons you spoke about. And some people just want to get along and they don't want to get involved. That's the other thing, personal ambition as well. But then at the same time, not having our community getting involved in the first place at the simple local level, So of course, if a community is not involved at the local level, not involved in volunteering in our own community's interests, then again, we'll have so many more, and we will have more reports in the future researching, talking about underrepresentation, but there won't actually be any change because you can't improve the representation without involvement. And as you see, so strategically on resources, loads of resources will go into continue researching and telling us there's underrepresentation, as opposed to supporting the involvement. Now, maybe that means that the involvement is our responsibility.
Sure.
Where does our responsibility lie?
Yeah, and if you look at that in mental health services in particular, which is really ironic, the underrepresentation in the workforce is clear, but overrepresentation in services is also clear. So we're underrepresented in the service delivery end.
That's right.
Overrepresented in as the recipients of the care.
And suffering from the highest level of inequality.
100%.
And unhappiness with the quality of service.
Yeah. And then if you look at the NHS as in terms of the physical, in terms of physical care, not mental health care now, again, COVID, the people that were on the front line of those services were the ones who suffered in terms of fatality and mental illness, because they're at the front line.
Yeah, and community transmission.
Indeed. So that's why I'm saying we need to have two sets of conversations going along, which complement each other. One behind closed doors, but also the public conversation needs to happen as well. Because it is that complex.
Yeah, and we call it separate and complementary.
Yes, absolutely right.
Precisely for that, because as we say, there are something in certain environments, there are some things best left unsaid. Because, and I say it to people all the time, once you've said it, it's been said.
Yeah.
No amount of apologies.
It's going to change
the fact that you've said it.
There's power in the life of the tongue, my friend.
Exactly. And that's been one of our difficulties. So, Beresford, that's been great. And I think what we're going to do, we're going to stop there because we're going to set that out as a framework. Then when we come back, we'll be able to detail out some of those points as we go to the next stage of this. And so we'll just open up. We've just got 10 minutes left. So we just have a general discussion now. And we've got our good friend, Dean.
Yes.
And I like Dean's perspective. He's always got a wonderful perspective. This is Dean Roden from Connecticut, one of our partners. Dean, over to you.
Why I tell you, I am so overwhelmed. I was working on my British accent to come on here this year. all through the holiday, I said, Dean, work on your British accent. But I'm getting there. It's just a pleasure. Wish you guys all the best for the new year.
Thank you.
Work you're doing. And I was listening to you about, collaboration and everything that you're saying. Some people wonder how old I am, because it's not wonder if it will work. All the things that the speaker was saying today, it's a reality. Being in a nurse's home for over a year, my dad is 93 and he died from prostate cancer. And up to 2 months before, my dad was painting the house, cutting the lawn at 93. So collaboration with all these things, physical, mental, spiritual, emotionally, this is what help mental case patient and people in life, And you can, I'm talking to a friend of mine, he mentioned Bob Marley. We're talking about, there's a mystic wind blowing in the air. And Bob asked him why. And he said, Dean, that song was sung many years ago. And what is going on? It's a mystic wind blowing in the air. Many people have to die, many people, and we don't ask him why. And not only that, I tell the guy, said, can you just say one thing to the world? That I was a guy that used to cook for Bob Marley. He was a child. When I was a child, he said, yeah, it's true. And you could eat healthy, but if you don't do collaboration with physical and spiritual, many people are doing this wonderful diet. And, as I said, my dad, he was retired at age of 70 and he never stopped work. Like he continued work. And this guy who were very fit, they do exercise, they eat healthy, they don't eat meat, they go to the gym. And I know that guy died at 70, right, coming out of his gym. So collaboration and balancing do a lot. And back to the, I'm you're not gonna limited amount of time, but your conversation is so to the point because of my over 30 years working with scouting. When I was sick and in the hospital, machine was taking me up the bed to put me in my wheelchair. And what did I do? I said, I've been training young people to be physically strong, mentally awake, and spiritually. And I did all that I've learned. And I can tell you, the scouting program is not the people that in the scouting, but it's a program that I implement and do my recovery. And they said, I'm here and I'm out. And they said, do what you like. And I'm doing what I'm like, giving back service. Been recuperating is like a rapid recovery because of service giving back. And many people who I said, Dean, you're okay. They would think that I'm 100, but because of this service is stressless, and stress is one of our main killer. And I urge people be involved in giving service and listen to our youngsters and listen to people who are under mental stress, because if they get a listener, that can help a lot of problem. And sorry to be taking up so much of your time, but I am so excited when I come on this program. And next time I'll work on a British accent, but thank you for
Dean, I think, Dean, we have to work on our Jamaican accent. I think that's the way around, to be honest.
Right. Thanks for that perspective, Dean. And you mentioned an important word there about servant leadership. And earlier on, Beresford and I had spoken about well-being, emotional, and obviously servant leadership. And we need more people to aspire to serve, then lead. People who are in positions of leadership, which Beresford touched on, who are in leadership now need to serve, because one thing that I was taught many years ago, that leadership is a badge that can be pinned on anyone. And a lot of the time when you're having to deal with difficult situations, particularly in a crisis, that usually is a time that you find out whether a leader is just a badge on that person. And whether they know what to do. Can they stop everybody turning on each other as they face the difficulty? Can they set the direction to find their way out of that situation? And that's what we're kind of getting now with COVID. We're being forced to work out who can really lead. And it's not necessarily the people with the badge on.
Sure. Couldn't agree more.
Right. Okay. So we're coming to the end, Beresford. I'd like you really just to summarize and today's start. It sets the agenda. Just to say before Beresford. No, I'll let you summarize and then I'll just end the program.
So once again, Rudy, I think it's all been said really, and Dean summed it up really well. But I think the bottom line is, in terms of moving forward, particularly around mental health, it's an understanding that we're building strong and effective care systems, and the local authorities and the corporate world cannot do without local community. So it's the collaborative effort and the partnership effort is what is fresh and not necessarily new, but certainly there needs to be that leadership that you've just described. So it's about collaborative leadership, but a serving collaborative leadership.
Yeah.
Those that are in the lead, in our communities who are leading, it's now time to actually start serving in the way that you said. And I think the digital space is really going to help us consolidate some of this, because as you know, we don't have to, in terms of meetings and bringing people together, I think that's the new normal, and you can do that on digital services. How else would we get Dean joining this conversation from the Caribbean? It's just, to me, that's what we're about.
Yeah.
And the more we bring people in the same spaces together to share some of the challenges, that's where the expertise is going to be developed. Because we have the expertise, but it's about sharing.
Yeah, and we can certainly create some greater knowledge sharing forums, because we've been able to reach out to thousands of people over the last few months, and physically we just never would have done that. And as you said, on the international side, people such as Dean, and we're involved in a wide range of other programs and activities that just would not have happened. And in fact, relationships have been built very quickly as well online. So, okay, thanks for that, Beresford. Just to say to everybody very quickly, this show will be broadcast again next week on Fresh FM Radio London. I'll be back tomorrow 6:30 till 7:30 with Let's Talk Hair Health and Wellbeing with Derek DeCutter Clement. Donna Spencer's a guest. Then be back again, I think, on Wednesday. Yes, I will be back on Wednesday. We'll be Health Talk on prostate health with Frank Chiniwando and Vasco Stevenson. And then back again on Thursday with Howard Horton around leadership again. So, you know, it's business as usual. Thank you very much, and see you all again. Thank you. Good night.
Good night. Thank you.
Good to see you, Lyndon. Thank you, Angie, for being on
You're welcome.
all day. Thank you. And Dean, see you tomorrow.
You're welcome. Thank you.
Bye.